Good day. I'm Dr. Jennifer Gutierrez. I am a medical speech-language pathologist and also a clinical assistant professor in the Department of Otolaryngology at the Texas Tech University Health Sciences Center School of Medicine. Thank you for this opportunity. For the past few years, I've had the great experience to travel to northern India, to King George's Medical University, where I treat patients and I teach part of a medical course. I have developed friendships and relationships with the physicians on campus, and they have brought specific problems to my attention. We're going to talk about one of those problems today. They do not have a standardized or efficacious way to measure degree of nasality in patients who have had cleft palate, neurological trauma, or some type of oral structural deformity from something like cancer. Those things change the sound of speech. Let me explain. There's a muscular fold at the back of the palate that is supposed to raise and close the nasal airway during production of non-nasal sounds. If it's not there or doesn't work, the speech can sound nasal, or there can be bursts of air from the nose during speech. This is embarrassing, and it can cause bullying, poor academic performance, low self-esteem, and it can inhibit someone from getting gainful employment. We think we have a solution. We're going to use a multi-parametric approach, beginning with an accessible, inexpensive piece of equipment that measures nasalence. Then we're going to take other aerodynamic measures, such as having a patient sustain a voiceless consonant. We will take the metrics from all of the aerodynamic measures and plug them into an algorithm that yields a nasality severity index score. And that score will determine if the patient needs a prosthodontic speech aid appliance. That speech aid closes the nasal airway and restores normalcy to speech. This is innovative, guys, because this is not how it's commonly done. Normally, we put a scope through the nose and we look at the biomechanics of muscular function to determine if surgery is needed to correct the problem. And this is not a good idea for KGMU. The scope is expensive, not durable, must be cleaned for long lengths between uses, and also there's risk of infection from the surgery. And evidence supports what we're doing with the multi-parametric approach, first introduced in 2007, refined in 2016, and then there's an elegant study done by Dr. Shaini in 2015 that talks about prosthodontic use amid poor velopharyngeal closure. What are the impacts we hope to see? Well, we hope to produce an internationally viable, inexpensive, non-invasive, evidence-based, and effective way to measure degree of nasality. And subsequently, we also want a scientifically validated way to recommend the use of prosthodontic speech aid appliances. Number two, we want to qualitatively measure the perceptions of speech samples by healthcare providers and patients. We want to know how the speech is perceived and how patients feel about their speech. For number one, we will collect data. Descriptive and demographic data, diagnostic data like primary and secondary diagnoses, and nasalence data. We will plug that data into various statistical analyses to compare pre-prosthodontic appliance placement and post-prosthodontic appliance placement. We also want to compare the etiology of the abnormal velopharyngeal closure. For example, does someone with cleft palate function differently than someone who has a cranial nerve issue? And if we want to, we might throw in propensity score analysis to randomize participants by algorithm, match participants, and then isolate the treatment effect from covariates or potential influencers like age, sex, and comorbidities. For number two, we're going to provide 5-point scales to healthcare providers and the patients to give us their perceptions of speech. We are funded by a grant, and we are grateful. We are in the early stages of development, having just discussed this idea in February of 2020 and refined it in October, November of 2020. What we ask is that you're open and that you listen to our idea and give your wonderful feedback, and possibly give some funding for the prosthodontic speech aid appliances, because KGMU is located in a resource-poor area. And ultimately, I would love to be a global leader or contributor to a program that provides therapeutic, evidence-based practices to healthcare models in different countries. So if you want to join or lead me in doing that, I would love to talk to you. Thank you and happy 2021.